The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone. Thank you so much for joining us today for the Understanding the Basics of Medicaid, Intersections with Mental Health presentation. I'm going to go ahead and give folks about a minute or so to hop on, so feel free to use the restroom, get some water, do what you got to do before we get started. All right, super quick break there. Just because I know we have a lot of great information to share, I'll go ahead and get started. So my name is Alejandra Del Toro. I am the project coordinator with Empower Idaho. For those of you that are unfamiliar with Empower Idaho, we are a nonprofit organization here in Idaho that offers provider trainings, education, and advocacy for adults with behavioral health conditions in Idaho. Again, welcome to the session here with Logan Dennis, our presenter, and Sierra McIver, our ASL interpreter. We'll be going over the Understanding the Basics of Medicaid, Intersections with Mental Health presentation. And before we officially get started, just to share a quick overview of the software that we are using. All attendees are muted. So the way that you will communicate with us is through the questions drop-down box. Feel free to insert any comments or questions through there. We, again, have a lot of information to go over, and so we'll reserve some time at the end to address those. But please, as the questions come by, go ahead and type those in. Just know that the answers will be provided at a later time. So I'll go ahead and turn it over to you, Logan, to introduce yourself and get going.
Well, hey folks, I'm just so glad to be here. My name is Logan Dennis. I'm a Health Policy Research and Communications Associate with Idaho Voices for Children. And I'll go ahead and tell you a little bit more about my background in a moment, but I am really excited to talk to you today about Medicaid. And so in this presentation, we have a couple of different objectives that we want to understand. Alejandra actually went over the webinar logistics already, so that saves me some time. Really good, thank you for doing that. Like she said, there will be a section for questions and answers at the end of the presentation, so feel free to type those questions in at any time when they come up. Just know that I won't be answering them until the end. And just, I guess, a brief disclaimer before we get really into the questions. I do not work for the Department of Health and Welfare, nor for the Division of Medicaid. And so I just want to make it really clear that while I do believe I'm a policy expert and have a lot of information to share on these issues, I'm not affiliated with the department. And when it comes to questions based on individual or familial contexts, you know, based on certain health conditions in your circle, or I guess what I'm trying to say, if the questions are very personal, I'll direct you to ask them to Health and Welfare, just because I believe that information regarding enrollment should usually come from the source. But as far as the general questions go, I'm really happy to answer anything, and I think I likely will answer a lot of them in the course of the presentation. So for the objectives today, there are 3 different objectives that I hope we can come out of this presentation accomplishing. First, we want to just build some general knowledge about Medicaid and the program. Second, we want to understand what services can be covered by Medicaid, so we really know what type of healthcare is available for this coverage. And third, we want to learn about the intersections of Medicaid with mental health in Idaho and why Medicaid is such an important program in the field of mental health. Before we do that, I'll tell you a little bit more about myself. Like I mentioned, I am a Health Policy Research and Communications Associate with Idaho Voices for Children. Idaho Voices for Children is a nonprofit that focuses on policies that help children and families thrive. Essentially, we are a nonprofit that does research into children's health children's health policy and contacts our elected officials and other community experts to get them involved in making that policy a reality. Some of the work that we've done in the past has included Medicaid expansion, the lobbying effort to secure the funding for that program, and we do a lot of work regarding just general children's health programs like Medicaid and CHIP in Idaho. And so I'm really happy to talk about some of that work today. My academic background, my undergraduate education is right here in Idaho at the College of Idaho out in Caldwell. My master's degree I got from Johns Hopkins in public health with a focus specifically on adolescent health and child health. I have spent, I think, around several years, probably since 2016 or 2017, working in the sphere of Idaho health policy. And so I have learned almost too much at this point, and I'm feeling knowledge being crowded out of my brain with how much I know about Medicaid now. So I am hopefully going to dump some of that knowledge to you guys, and I can make room for new stuff. But let's go ahead and get started talking about some of the basics. So Medicaid is a federal health insurance program that provides coverage to low-income families, children, people with disabilities, pregnant women, and seniors in some cases. Medicaid overall throughout the entire country provides coverage for over 97 million Americans, and children account for 40% of the entirety of enrollees. Roughly 12% of enrollees are people with disabilities, and the rest of enrollees are made up by adults and seniors under the income threshold. So that just gives you a picture of what Medicaid enrollment looks like around the entire country. Essentially, it's that health coverage program for those groups of people that provides them comprehensive coverage to ensure that their health needs are met. I'm going to talk a little bit about Medicaid expansion in Idaho now, because Idaho has a different brand of Medicaid than some states might. You might remember the Affordable Care Act gave states the option to expand their Medicaid program. Essentially, what expanding means is that they raise the income eligibility for Medicaid. Traditional Medicaid eligibility is set at the federal poverty level. Medicaid expansion is set to up to 138% of the federal poverty level, which in reality means that folks qualifying for expansion still are not making very much money per month. But still, in Idaho, the income limits were so stringent that those folks could not qualify for Medicaid. At the same time, they weren't making enough money to qualify for subsidies on the ACA exchanges. That created a phrase that you might be familiar with, the coverage gap. Essentially, folks did not make enough to purchase their own insurance, but made too much to qualify for Medicaid and couldn't get any type of coverage at all. This coverage gap still exists in several states across the country, but it no longer exists in Idaho. Because in Idaho, in 2018, we voted to expand Medicaid and raise those income eligibility levels. Expansion passed with 61% on the ballot, which still stands as the record of support for Medicaid expansion across the country, which really says something about Idaho. I think Idahoans really understood that there was an unmet health need going on in the state, that their friends and neighbors needed a little bit extra help getting out of the coverage gap, and that's why it was such a popular policy here. However, expansion was only implemented beginning in 2020, so we didn't have Medicaid expansion on the books until right before the pandemic started. And in hindsight, it was just really incredible timing, because this provided a safety net for tens of thousands of Idahoans during the pandemic. At this point, we have over 115,000 Idahoans who have enrolled through Medicaid expansion. And that's really phenomenal, and it's something that should give you pause, because that's 115,000 Idahoans, our friends and neighbors, would have had no health coverage during the worst parts of the COVID-19 pandemic had we not chose to expand Medicaid and fought for it to be funded. The fact that, this is the result of decisions, and that there are states that didn't have these type of protections for their residents is scary, and it should be something celebrated that we had Medicaid expansion in Idaho. And like I said, the evidence shows that programs like expansion or temporary emergency flexibilities on Medicaid prevented drastic increases in the uninsured rate nationally and in Idaho itself. A little bit more basic information about Medicaid. Who is eligible for Medicaid? So let's talk about adults. Income-based is typically the only way that adults are qualifying for Medicaid. Expansion increased the income eligibility level to 138% of the federal poverty level. This equates essentially in Idaho to an adult making slightly less than $1,500 a month. So when you think about their other expenses going to rent, food, childcare, etc., they're not left with much left each month. This is the type of people that we're talking about for Medicaid expansion. So we're not talking about folks that really can already afford coverage on their own. It really is tailored to people who need that extra little boost to help them make ends meet. And adults who are over 65 who meet the income requirements are not enrolled in Medicare qualify for Medicaid. So oftentimes there are adults, seniors, who either qualify for Medicare and not Medicaid, or meet the income requirements and qualify for Medicaid, or in some cases you can be dual eligible and qualify for both. When we talk about children, children are eligible for Medicaid via several different categories. If we're talking about income, children must be in a family at or below 190% of the federal poverty level. So that income threshold for children is higher than the Medicaid expansion level, but that still equates to a family making roughly $2,040 a month. Again, when you consider their expenses, not a lot left over. Medicaid really is a difference maker here that allows families to ensure that their health needs are met, that their children are actually getting the prescriptions, the doctor's appointments that they need, getting their immunizations, their checkups, etc. It really is there to help ends meet for families. Children with disabilities or behavioral health conditions can also receive Medicaid based on that diagnosis. And like I said earlier, this is a case-by-case basis. And so it is either based on a disability or a condition diagnosis that is within the Social Security guidelines, or it is one listed as a disability or health condition that qualifies for Medicaid on the Idaho specific site. And so again, that's why earlier I mentioned that it's always a question for the Department of Health and Welfare when it comes down to specifics like that. But children might also be eligible for CHIP, which stands for the Children's Health Insurance Plan. These eligibility levels have a higher range of income than Medicaid. So if a family makes slightly more than $2,040 a month, that's still not a ton of money for them to work with, but that cuts them off of the Medicaid eligibility level. That's where CHIP starts to overlap and can pick up some of the different levels of eligibility. These eligibility levels go to a higher income range, but again, the program sometimes has copays or premiums, which in instances of families with higher incomes, it's less of a burden for them to meet. But for lower income families, that can represent a hurdle towards getting your child enrolled in health coverage. Going back to adults for a second, let's talk about adults who qualify via age or disability. So like I said, in Idaho, adults can qualify via income if they are up to 138% of the federal poverty level, but they can also qualify based on age or disability. Medicaid provides coverage to adults with intellectual and developmental disabilities. Adults with disabilities can also physical disabilities qualify, and these qualifications are again addressed through Social Security Administration diagnoses, as I mentioned earlier. Seniors are also eligible for Medicaid to help cover additional services or needs for independent living. Sometimes this is separate from Medicare. Sometimes folks are dual eligible. It really depends on what services are covered in the state and what they're really using to qualify. Oftentimes it's really income based. I'm going to talk a little bit now about the types of Medicaid health plans that exist specifically in Idaho. So the traditional Medicaid plan that you often hear about when people are talking about just general Medicaid, they're usually referring to the basic plan. This plan provides health, prevention, and wellness benefits for adults who don't have special health needs. This plan also includes annual physicals, immunizations, covers the majority of prescriptions, doctor and hospital visits, and more. So that's what we're talking about when we usually talk about general Medicaid. The enhanced plan is the second type of Medicaid plan. And this plan is for individuals with disabilities or special health needs. Essentially, it tries to cater the plan more towards the health needs of the individual. These plans often end up being a little bit more expensive because of the coverage that needs to be provided. And I should clarify that they're not to the person who is enrolled, rather, but the services that have to be covered often end up being more expensive. And so that's why it's referred to as the enhanced plan, because it goes above that to cover different types of services. So this plan has all of the benefits that the basic plan typically has, but like I said, goes above that to meet the specific health needs of the individual enrolled and of their diagnosis. Most of the time, individuals need to be referred by a doctor to become eligible for this enhanced plan, because like I said, there's an SSA diagnosis that's usually required to get coverage for those specific services and procedures that come along with the diagnosis. So typically when someone's enrolling, it'll be in the basic plan unless they need coverage for something specific like that. that's when they would get the diagnosis and enroll through the enhanced health plan. All right, so this colorful little checkerboard I have before you is the list of general services that are covered through Medicaid. So I will go ahead and read through these so that you don't have to. Annual physicals, immunizations are covered, prescriptions, dental doctor visits, both inpatient and outpatient hospital care are covered by Medicaid, primary care case management, medical equipment, lab tests and prosthetics, emergency medical transportation, so ambulatory services, getting you to the hospital, stuff like that, medical equipment and supplies, smoking cessation treatment, vision treatment, medical transportation services, EPSDT services, and that's early and periodic screening and detection, essentially getting in and early looking at children to make sure we're looking and seeing, are there signs of illness, signs of chronic conditions, signs of chronic illness that are developing, signs of mental illness that we can catch early and make sure children get the treatment that they needed. So those are for children under the age of 21, and that requires authorization. You also have weight loss and x-ray services, home health care and home community-based services, which again, that will require a doctor's prescription for that. Nurse and midwife services, pregnancy and family planning services, and hospice care. So that's a lot of stuff. You will see that Medicaid covers a lot of different services and treatments. So it really does provide you a very comprehensive health coverage plan. And the majority of people who enroll in this plan are really going to be able to get their health needs met at a very basic level. If you move on to the enhanced plan and start looking at some specific specialized services that someone might need when they enrolled in the health plan, enhanced health plan, here are some of the behavioral health services that might be covered. Medication management, partial hospitalization or partial care treatment, community-based treatment and rehab services, intensive outpatient program and case management, alcohol and drug screenings, assessments, plannings, psychotherapy, both individual, group, and family types, and psychological and neuropsychological testing, as well as, very importantly, substance use disorder treatment. So these are all treatments that apply to behavioral health services, and oftentimes you're going to find them in the enhanced health plan being covered. And now that we're talking about mental health a little bit, I wanted to pause there and talk about why Medicaid coverage for behavioral and mental health services and conditions is so important. And that's because the mental health needs in Idaho are high right now. Our data nationally shows that about 1 in 4 Idahoans are impacted by having a mental or behavioral health condition. And this ranges, that's a very large, broad, encapsulating term. That can range from depression or anxiety to Idahoans with severe mental illness. Idaho's rate is the highest in the entire country. And that should really resonate with folks. That there's not a state that has a higher rate of mental and behavioral health conditions or impacting their population than Idaho. Nearly 70,000 Idahoans had SMI diagnoses in 2019. And experts expect that many of these diagnoses are unreported because this is such, oftentimes, folks with mental health conditions either don't have the resources to seek treatment, don't have the community structure around them to assist them in getting to treatment, or oftentimes because of the stigma around mental illness and behavioral health conditions, they don't want to report it even if they know they need help. There's just such a stigma that we know this statistic is unreported. So we know we're the highest in the country and we're still not getting the full picture. Data shows also that half of these Idahoans received no mental health treatment. In terms of access to mental health treatment and folks with mental health conditions receiving treatment, Idaho ranks 48 out of 50 states in terms of providing access to these services. So there is a real need in Idaho right now, and it's not entirely being met. We also see some really troubling trends for kids in mental health. In 2020, nearly 20% of Idaho teens had depression, the second highest rate in the entire country. We're seeing kind of a pattern here develop for Idaho, right? 55% of these teens received no mental health treatment. And underscoring all of this, 24,000 children in Idaho are completely uninsured, preventing them from accessing crucial health services to keep them healthy or to meet their mental health needs without paying directly out of pocket. We're in a state right now that even as we have made jumps forward with Medicaid expansion, we have not done enough to address the mental health crisis in the state. And that's why it's really important to understand how Medicaid expansion, and CHIP can all be tools for us to help make sure that Idahoans are getting the care that they need, that they're addressing issues that they're having in their life, and that they have access to care in the first place. Medicaid can help bridge this gap. Following Medicaid expansion, service utilization of mental health services significantly increased. It actually outpaced projections. And this is something that I wrote my thesis on for my master's program. What was really interesting in looking at Idaho's data is that we put in pretty, I don't want to call the estimates aggressive, but when Milliman, the actuarial firm that was developing funding sort of projections and enrollment projections for Medicaid expansion, it wasn't an aggressive projection, but they assumed there would be a pretty high need for mental health services in the expansion population. And it was much, much, much higher than any of the experts had predicted. And actually, Idaho's utilization of mental health services in the Medicaid expansion population outpaces all of the other expansion states surrounding us. So it shows that there was an enormous unmet mental health need within the expansion population that is just now starting to be addressed. And this helps us show and really proves the case that when access to services is improved, Idahoans utilize that treatment and they get the care that they need. Medicaid expansion is showing us that if we increase the access to treatment, people will utilize it to help ensure that they can be healthy and happy. And this is really, it's the beginning of a success case for Idaho, where we can really hopefully start to stop being the worst rate in the country for some of these mental health impacts and start being a state that takes care of their friends and family when they need it. And I think Medicaid expansion really is going to help us continue to do that. So some general information now about Medicaid and applying. There are several ways to apply for Medicaid. You can visit an in-person office and fill out a paper application. You can visit the link that I have on the screen right here, and I'm probably going to go ahead and copy and paste that into the chat in case anyone needs it later. Or you can call the number 877-456-1233 or visit the Medicaid website for an in-person application that you can turn in or mail to the Medicaid office. So essentially, there's several different ways for you to apply. If you have consistent internet access, I'd say that applying via the internet is the easiest. Considering COVID, it's also probably the safest way to do so right now. But if you do not have broadband access or consistent access to the internet, that should not stop you. There are other ways that you can get enrolled or help someone that enroll in Medicaid. When you do apply, you should be prepared with identity documents. Think about the type of documents that you typically use when you're applying for a job or establishing identity, or when you go to the DMV, that type of stuff. Verified household income and monthly expenses, because you are going to need to prove how much you are making per month to be able to qualify for that monthly threshold, and immigration documents if that's applicable to your case to prove citizenship. So you need those type of general documents when applying to be able to move forward with the process. Okay, I know I speak pretty fast, but I feel like I just went through a ton of information pretty quickly, and I am certain that a lot of people have some questions, and I hope that I have some answers. Let's go ahead and start taking some of these questions, and just so that this information is available to everyone, I'm gonna actually leave us on this page in case anyone needs this number or link directly. But I'm gonna go ahead and start looking through some of these questions and see if I can answer some of them for you.
And Logan, while you do that, I just want to quickly note verbally to the audience that a copy of the slides is available under the handouts dropdown. So please do feel free to download those so you have that on hand. And the session is also being recorded, so we'll have it on our website soon.
These are some good questions, folks. Okay, I'm going to start from the top. I see, are the income threshold levels the same for enhanced plans? Yes, everything besides Medicaid expansion has these same income thresholds and limits as far as Medicaid goes. The enhanced plan is more dependent on a specific diagnosis. And I will say oftentimes there are conditions where you have a severe condition that can qualify you for the enhanced plan outside of income thresholds. So there are times in which your condition can qualify you for that coverage. But again, that is a question for the Department of Health and Welfare because that's case by case basis type of scenario. I have a question of, are only preventive dental services covered, or are treatments and dentures also covered? I know that dental services and treatments are covered. I can't give you a 100% answer on dentures, to be honest. I would say that's a question for health and welfare, but I do know both preventative and treatments are covered. I do have a question about if counseling services are available on the basic plan. I do believe general counseling services are available on the basic plan. I believe the counseling services I referred to in the enhanced plan are usually specialized counseling services that are for specific conditions or outside of the realm of general therapies. Is the state working towards expanding providers in mental health? I hope so. I really hope so. I can't say with complete certainty. I know that mental health is becoming a bigger priority in the field of health overall. More people are understanding how big of an impact that it has both on the other facets of your life and even your physical health. And so I know within the Department of Health and Welfare and Medicaid services, they're making it more of a priority. I know the state itself, I can't speak to any specific effort to expand providers or create new providers. I know that existing providers are working very, very hard to meet the current burden and need that we have. But I can't speak to any specific efforts where the state would expand the providers themselves. And we did have someone from the audience that does confirm that yes, counsel is covered under the Medicaid basic plan. Thank you. Like I said, I do feel very certain of myself sometimes, and I felt that was the correct answer, but I feel a little hesitant giving specific answers sometimes when I would default to the Department of Health and Welfare. So thanks for backing me up on that one. So we have, what is capacity for providers to serve Medicaid recipients? Not all healthcare providers accept Medicaid. Yes, this is an important denotation to make. Healthcare providers, typically if they are a Medicaid provider and they accept Medicaid, it is because they do have the capacity to serve an increased amount of folks coming through, their clinic or hospital or whatever type of provider setting it is. But like the question noted, not all providers in Idaho accept Medicaid. And so if you are covered by Medicaid, you will need to go to, I don't know that in-network is correct, the correct term per se, but if you think about insurance terms, something like that, a provider that will take Medicaid. Just reading some questions real quick. So we do have a question. Medicaid generally does pay for inpatient substance use disorder treatment, but the local inpatient treatment facilities have been telling folks that Medicaid doesn't cover it. They've heard that this is because the process for approval is so bulky and time consuming. Do you have insight into this problem? This is this specific substance use disorder treatment isn't my entire expertise in Medicaid, but I'll try to provide some guidance where I can. I think the approval process is bulky and time consuming. Oftentimes when you see government programs in general, it seems that the enrollment and approval process almost seems purposefully difficult or hard to navigate. This is one of those cases where there's a lot of hoops to jump through and a lot of sort of switches to flip before something is covered and like you said, they get the approval. So I think that's kind of what the situation happening right now seems to be, because Medicaid should cover those services, but it does seem to be that there is a roadblock in getting approval for those services to be classified as such. I don't know that I can offer a lot of context beyond that, but it does seem to be a problem with codifying whether or not these are, substance use disorder treatment or not. And so it seems that that approval process does have a lot of holes in it right now. Does Medicaid offer reimbursement to the client if the provider doesn't accept Medicaid? I think this, this is a really context-specific question, because that means that someone's getting to the point of service, typically in like an emergency type scenario, right? Because outside of that, usually you're going to know the network of providers that you should be going to, or you'll be referred specifically to someone that does accept Medicaid if you're referred to a different provider. So if you're getting to the point of service and finding out that the provider no longer accepts Medicaid, I think that's almost, to me, I'm imagining, like emergency services where that happens. And that's usually in hospital settings where Medicaid's accepted. So I believe that shouldn't be a scenario that comes up very often, but I can't give a solid answer. If they don't accept Medicaid and someone was treated for it, I don't believe, if you wouldn't mind sending me your email, I think I'll do a little bit more digging into this question and I can get back to you on it, because I don't want to give a solid answer right now, but I would love to look into that because it's a really good question. Thank you for typing that. All right, folks, I'm just reading through a couple other questions here. So I do have a question about Medicaid coverage for incarcerated people. It's a little trouble when folks are incarcerated. So there are some types of Medicaid coverage that you do lose access to upon incarceration, but if folks are Medicaid eligible, they can still have inpatient and outpatient care covered by Medicaid. There are also parts of Medicaid expansion that apply to services that are carried out for incarcerated people. For example, a lot of mental health treatment, substance use disorder treatment that used to be on the Department of Corrections budget has moved towards Medicaid budget because expansion allows those services to be covered. But as far as general coverage, you don't retain the entirety of the coverage, but you still can have coverage for inpatient and outpatient treatment as long as you're still eligible. Sorry, folks, I'm just reading through some of these. The text is super small, so I got to expand it to look at the questions.
All right, Alejandra here again, everyone. If it is easier for you to verbally share your question, please feel free to use the raise hand feature and I can unmute you. Again, that's another option.
And we do have a comment about how the question earlier about arriving and understanding whether or not the provider will accept Medicaid would fit more rural areas. And that's a really good comment. Yeah, that does make sense. In rural areas, it would be nice to know in advance whether or not that's going to receive reimbursement. And you're totally correct that in rural areas, this is much more of a problem and there are fewer Medicaid providers in general. So that this does become more challenging to navigate. And then I've read a couple of different I'm very happy to have a bunch of other experts in the question and answer section right now, because you guys are teaching me a couple of things, but I've seen a couple questions that actually address each other, funnily enough. And so the final one that I will share this comment because I think it's helpful for contextualizing the other questions. And thank you, Becky, for sharing this, is that Idaho Medicaid does single case agreements with facilities, and they don't do that outside of their realm. What that means for the earlier question, as far as that goes, is that unless an Idaho Medicaid provider or unless there's an Idaho Medicaid provider or facility, there's no mechanism in place for Idaho Medicaid to reimburse the provider. And so that's what I was. Thank you for helping clarify that, because that's what I thought was the case as well. Is because Idaho Medicaid would not necessarily be authorized to cover and bill out that expense in the first place. Do I have a rough idea of how long Medicaid will continue to pay for telehealth services? I wish I had more than a rough idea, but what I can tell you is a lot of these telehealth flexibilities and changes that came about during the pandemic are tied to the public health emergency declaration itself. And so I think specifically some of these telehealth flexibilities, I think some of them are through 1135 waivers. I think some of those are tied to the public health emergency declaration itself, and they might phase out once the declaration is removed. There are a lot of policy advocates that are wanting these telehealth and other flexibilities to be made permanent. And I know Senator Crapo has been considering proposals in tandem with Senator Wyden of how they can improve telehealth access after seeing how it was, especially in a state like Idaho and Oregon, very high rural populations, it was really handy to have telehealth services. And so if they're able to, they would take that and take it away from being tied to the public health emergency declaration and either extend them on a, typically the extension is for something like 5 years or making it permanent. That has not been made happen at a federal level yet. So as far as my rough idea goes, I would say as long as the public health emergency declaration is active, which I know runs at least through January of 2022, might get extended at least one more time. Until there's a move to make those permanent outside of the PHE declaration, they might expire. Is Idaho Medicaid accepted in other states, like if someone was vacationing and was injured? I believe there's coordination that happens between Medicaid programs in that instance. But again, it would be similar to a case where you're traveling and you have Blue Cross Idaho and you're injured somewhere. It's not necessarily that state has Blue Cross Idaho, but your coverage is good there. And so it still will be worked out through Medicaid departments like that. You're not going to end up just paying completely out of pocket. I would caution though that might be different in non-expansion states if you're expansion eligible, now that I'm thinking of that question, because our eligibility standards are higher than non-expansion states. There could be a scenario in which you are Medicaid expansion eligible and it doesn't line up with another state's laws. But I believe in that instance, you would still be covered via Idaho Medicaid at the end of the day, because that is your insurance coverage. So that's still where the bill would go. Are there Idahoans who have full Medicaid and full Medicare? There are Idahoans that have the dual plan, which is essentially Idahoans who are seniors that have Medicare, and they also have Medicaid for some specific needs. So that's usually if there's a specific diagnosis that they need additional assistance with, that's when that dual eligibility often comes in. And so I don't know that I would necessarily describe it as necessarily full Medicaid or full Medicare, but that dual plan essentially means that you're traditional Medicare eligible and likely also have some other special health needs that need to be addressed, and that can be done through Medicaid. Okay, I'm not really seeing any other questions come in. If any other folks have questions, go ahead and please use the raise your hand or the question and answer function. But happy to stay on here for a couple of minutes and wait though. We do have a question that popped up. Is my understanding that Medicaid is the payer of last resort? If they deny a service, the provider must write off any balance associated with the service. Is this your understanding as well? This is probably referring to the state CAT fund and the county indigent funds. So that's when that medical indigency happens as such. And hospitals often refer to this as charity care when it's their write-off. So essentially, in that scenario, our county and state programs for indigency funds end up picking up the tab. And so, for example, the county indigency fund or the state catastrophic health fund, those are public funds that exist that help unpaid medical bills. Are there charts which summarize this? Well, I guess, I don't know, maybe if it's the specifics between the differences in Medicaid programs or if it's some of the information I shared today, I'd be happy to share the slides as a PDF and the resources that I used for it. But there are more specific charts on the Idaho Health and Welfare website that refer to a lot of these different differences and the details for the different plans. And so they definitely would be the source for you to check for more specific charts and resources, graphics, that sort of thing. They have a lot of really good stuff on their website. All right, folks, I'm not seeing any more questions and I'm not seeing any hands raised. I'm gonna go ahead. Oh, I did just see a question. Can you speak a bit about what Idaho Voices for Children is currently focusing on? I would love to. So right now, Idaho Voices for Children, one of our biggest priorities is our new initiative, Idaho Kids Covered. Idaho Kids Covered is a policy advocacy group, a coalition made up of different health policy experts, organizations, et cetera, across the state. So we work with hospitals, healthcare providers, other research groups like Idaho Voices for Children to look into children's health policy and children's health coverage specifically in Idaho. We have the goal of making sure that every single child in Idaho has health coverage. So the information that I shared earlier, there's around 24,000 kids currently in the state without any type of health coverage. Our goals sort of revolve around passing policies and figuring out ways to ensure that all of those kids can have coverage, whether that is, eliminating paperwork burdens that trip families up and keep them from enrolling, closing different loopholes that end up, leading to gaps in coverage for children, increasing eligibility for different families, or just generally fighting to protect the Medicaid budget. There's a lot of different work that goes into that. And as we're continuing to develop our policy agenda heading into the legislative session, and we'll have a more specific sort of line item of what we are proposing or what we want to defend this session. But right now we are really just in a research phase where we are still making partnerships with other organizations around the state, getting to know more about health policy in Idaho, understanding what information officials need to make these changes, to make policy tweaks and stuff like that, and getting it into the hands of legislators who oftentimes are the decision makers on issues like that. And so we're currently focusing on that. I shared earlier that there are some temporary emergency flexibilities around Medicaid and CHIP, such as telehealth. If folks are familiar with Medicaid at large, there's the maintenance of effort emergency provision this year that allowed more people to enroll in Medicaid and prevented states from disenrolling anyone from Medicaid during the pandemic. When that provision expires, there's going to be a deluge of work that the department is going to have to go through in either disenrolling people that are no longer eligible or verifying that people that were enrolled via that maintenance of effort are still eligible. That's going to be huge, and there's a really large potential there for kids and families to lose coverage even though they are truly eligible, just because of the there's nearly 100,000 cases that are going to need to be processed rapidly. So we are ensuring that we know everything about this, that we can recommend the best policies to our Department of Health and Welfare to easily unwind this maintenance of effort, and that we are really monitoring the situation to ensure that no child in Idaho loses their health coverage because of a paperwork error or anything like that in unwinding the Medicaid emergency flexibilities. And so I always say at Idaho Voices for Children, what we're working on ends up changing month to month because there's always something on fire. But these kind of tend to be the issues that we're working on right now. And thanks for asking about that. All right, folks. Well, I am not seeing any other questions come in. Right now, I am going ahead and typing my email address into the chat box. That's ldennis@janus.org. If at any point questions about Medicaid, my presentation, what Idaho Voices for Children is working on, the Medicaid budget, etc., if any questions like that come up, feel free to send me an email. I talk about Medicaid all day long, every day, so I'm happy to talk about it like anytime. I really appreciate folks joining me today for the presentation. I always love getting a chance to share some of my knowledge, and like I said, every single time someone in the audience knows something that I don't, and I learn something giving my own presentation, which is always fun to do. You would think after spending this long in Idaho Medicaid, there would not be so many new things to learn, but it's a massive program, and I'm always learning new things. So thanks for teaching me a couple new things today, and I really hope I taught you some stuff as well. Thanks so much for joining me, and thanks to the folks at Empower for putting on this opportunity and for really getting the ball rolling.
Yeah, absolutely. Thank you, Dennis. Or, I'm sorry, Logan. Thanks so much, Logan. Your parents what, sorry?
They made it tough on folks. My two first names. My middle name's Lewis. So the whole thing's just a mess.
Oh, I love it. Well, thank you, Logan. This was a really great, informative session and obviously very important. And so I think all of you that attended this training, because again, it's a really important thing that affects us all and, you know, the clients that we serve. So really means a lot that this is a session that you took some time to attend. So this is actually Empower Idaho's last training for the year, but we will be back next year on 2022 with some awesome trainings and awareness campaigns and all that. So stay tuned. I did put in the link to sign up for our newsletter so you can stay in the loop about all of that. And I also welcome you to fill out the evaluations because it does help us be better, know what's going well, and you know we really value your opinions because we're here to serve you. So thank you again. Appreciate you all.
Take care, folks.